welcome back to my YouTube channel. I'm still your favorite girl, Prominent. In today's vlog, I want to address Nkechi. Nkechi, yes, you. So you came to the hospital today and you wanted to see a doctor. I am the CNA on duty. I checked your blood pressure and I saw it was 160 over 100. Then I checked your previous record. I saw 170 over 100. I checked your previous records and I saw 180 over 100. And I raised an eyebrow. I looked at the record. I saw you were prescribed medications. I asked, Nkechi, have you been taking your medications? I don't have hypertension. It's not in my family. I reject it in Jesus' name. When I rest, it will be fine. I will get better. My blood pressure will come down. I do not even have blood pressure. It is not my portion. And I'm like, okay, why do you think is that a problem? Why is it a problem to you? No, I can't start taking drugs, or I'll take drugs all the rest of my life. I'm like, but is it not better you take drugs all the rest of your life and be alive rather than dropping dead? Because the last one was a 180 over 100. What if the day it climbs to a 200? What now happens? You drop, you probably will have a hemorrhagic stroke. Either you get paralyzed partially or you go into a coma that you never come out of. Which is better? You say, God forbid, it's not my portion. I will not have that. It is not in my DNA. I believe in this, I believe in that. Well, since I'm just a CNA, I believe the doctor will address it. So you go into the doctor's office, you come out, and I still saw you have prescribed an antihypertensive drug. And I say, oh, this is your bill. You have drugs. He said, no, you're not collecting. You'll be fine. When you sleep, you wake up, you'll be fine. In that case, in such a scenario, what will you do as a CNA? Or what will you do as a doctor? How do you counsel this kind of patient? Because I've seen them a lot. Nkechi is not the only person. There's Nkechi, there's Ngozi, there's Ali, there's Shehu, there's Yemisi, there's Bola. There is all sort of, if they're out there. Or when they even manage to collect these drugs, they take it once and that is the end. They are not frequent with it. I've seen scenarios like that. I've seen people with hemorrhagic stroke. Some come out of it, some do not come out of it. Some eventually, that is the end of their life. Some do not even have high blood pressure, maybe until they get pregnant and they have preeclampsia and they are not following their drugs. Then they go to antenatal one day and the doctor say, oh, you need bed rest. And my dear friend Bola will say, no, I'm fine, I will go home and go and rest. Eventually she doesn't go home to go and rest. She goes somewhere else. After she gists with her friend, she comes back home. She still doesn't sleep. She will be on her phone till 2 a.m. Then in the middle of the night, she will now wake up and her chest is beginning to tighten. She's rushed to the hospital. She takes her 2 legs and walks into the hospital. And that is the genesis of the problem. Before you know, the BP goes up and her life is cut short. She doesn't come out alive. She and the baby are gone just because we are careless. We think that we can pray. Yes, you can pray away. You can pray yourself into your purpose. But you can also do the two together. Take your medications and pray your way into your purpose. I've seen a lot of scenarios. I've seen people who went into a hemorrhagic stroke and didn't come out. I'm repeating it because it happens. Most times I go for outreaches and I see some of my patients, people that came for the outreach with a high level of blood pressure. Most times I sit them down there, I give them an antihypertensive to just calm it down, and I recheck the vitals. And when I see it has dropped or they are okay, I can tell them to go and say, go and see a physician. You need to see a physician. And most times I try to follow them up to be sure that they actually saw a physician, because, God forbid. So this is just a little way of me explaining. I think I will bring a doctor in to talk more about hypertension, hemorrhagic stroke, so that we learn from it. It is not a death sentence. It's better you be on frequent drugs than you are not at all. A lot of us, me, I don't have BP and I'm on the big side because I do a lot of exercise. I walk, I do intermittent fasting, I watch what I put into my body. Sometimes, not every time, I'm not so consistent, but I try as much as possible. My BP is a 90/60, 100/80, yes. I've seen bigger people on the bigger size who have BP. I have seen slimmer people who are stressed at work with high blood pressure. I have seen slimmer people who are as thin as my hand, size 6 people with high blood pressure. So it does not have, this one is fat, no, that's why it has BP, this one is slim, that's why it does. No, different circumstances. Some people is hereditary, some people, their family is, if you trace the gene, is there in their family. So if you're in that category, you need to start being careful. If you have that traces, and if you're doing a tedious work, you need to also be careful. Then I think everybody in their house, every household should have a blood pressure machine, the digital one. It helps. So a normal blood pressure is 120/80. When it starts going higher, you need to see a physician. When it drops to 80/50, you also need to see a physician. So I don't know how to stress it enough. Please, Nkechi, Bola, Aisha, and every other person who is this adamant about taking drugs, please reconsider. See a physician, and a physician will counsel you well. Thank you very much for listening to my teach chat, and please do not forget to like, subscribe, and comment. I'm still your favorite girl, Prominent Odin. Until next time, have a good day. Bye.